Greetings, Family Nurse Practitioner students. I'm Joanne Singleton, the Program Director, and I'd like to have this opportunity to talk to you about the new delivery model for the Family Nurse Practitioner specialty courses. The new delivery model goes into effect in the fall of 2008. Why a new delivery model? Well, first and foremost, because we are committed to delivering a quality program. And the evidence has told us from our student evaluations and from preceptor and faculty input that in some instances students have a very difficult time completing both clinical credits and didactic or classroom credits in the same semester. And so based on this, we have designed a new model so that students will be able to take their classroom credits separate from their clinical credits. In the fall of 2008, NUR 674, also known as Advanced Health Evaluation, will be offered to students on both the Pleasantville and the New York campus. In the following semester, the Family Nurse Practitioner students will begin their clinical management courses. The first clinical management course, which is the classroom portion, is known now as NURS 650. This is a 6-credit course. Students will meet on campus one evening a week, and then we'll be working in an online environment for some additional problem-focused work outside of the classroom on a weekly basis. In the spring semester, students, in addition to taking the NURS 650 course, are required to take one clinical course. There are a total of 6 clinical credits in the program. Each of those 6 clinical credits equals 110 hours, and those hours are divided over the population that nurse practitioners who are family nurse practitioners care for. 220 hours are adult hours, 110 hours are women's health and includes 40 OB hours in the assessment of the prenatal patient, 220 hours are pediatric patient hours, and 110 hours are older adult hours. Each one credit is equal to 110 hours, and students are required, as I said, to take one credit along with NURS 650. In the summertime, students will not take a classroom portion. They will only take clinical credits and are required to take 2 credits of clinical. In the fall semester, students will take the next level clinical management course for family nurse practitioners. Along with that, they are required to take 1 clinical credit. Students may be given permission to take more than 1 credit in the spring semester, up to 2, and students may be given permission to take more than 2 credits in the summer, up to 3 credits, but students must not take more than 4 clinical credits before the fall semester and the NURS 660 course. The advantage to this model is that students who are taking the minimum required clinical credits have the option of 1 additional semester after they've completed the didactic courses to complete the clinical credits. We hope that this will help facilitate learning for the students and also will require students to no longer take a classroom course in the summer semester along with the clinicals, which we've identified as being very problematic. One of the key points to this new model is that the clinical credits are taken not simultaneously but sequentially. So a student must take and complete successfully the clinical credit before going on to the next clinical credit. I hope this information provides you with a better understanding of the new delivery model.